Now, the National Department of Health is launching the national rollout of the 6-month multi-month dispensing program for ARVs. This initiative is designed to allow stable HIV patients to collect their medication supply only twice a year, which will reduce clinic visits. Since 2023, eligible and stable HIV patients in South Africa have been receiving 3-month supply of antiretroviral medication at a single clinic visit. Now, for more, we are joined by Dr. Nonhlanhla Ndlovu, who is the Deputy Director General for HIV, AIDS, TB, Maternal and Child Health at the National Health Department. Doctor, thank you. Thanks for joining us. And, you know, I must say, I think that this is a very good move for the individuals that qualify for this. I mean, with over 6 million people on ARVs, how will this multi-month HIV treatment dispensing program make it easier for our health system to cope with so many patients? Doctor, it sounds like, I'm not sure if you're on mute or if we've got a problem with the sound. Can we double check on your side? Let me hear.
Thank you.
Much better. Okay, we got you.
Here.
Now I can hear you perfectly.
It's a 6-monthly dispensing at a facility. And basically here we are concentrating on our patients who are coming to our clinics and who are very stable. We've got over 4 million people on ARVs who are stable, who are taking their meds very well. And we know that our clinics are full. So one of the things is to work together then with our patients to say, if you're stable and you're doing well, you can get your 6-monthly treatment and take it, and we'll continue monitoring you twice a year. And this, we believe, would assist patients, ourselves, but also to start to say to ourselves, patients also have to take care of their health, which we believe they are, and we have to trust them in terms of that.
So one of the big problems, however, is the rollout of these multi-month dispensing programs it hasn't been equal. Like, it's been inconsistent. Some provinces offer 3 or 6 months routinely, others only provide 1 or 2 months. I know you know this problem, but how will you ensure that the patient's access to 6-month dispensing now doesn't sort of depend on their postcode?
I think what we are trying to do is to make sure that our facilities are ready. This is the first part. And I think as you are indicating, some facilities had started. We were doing that as more of a pilot so that we could see what is happening. So our rollout is spaced in its approach. So we will make sure that the facility is ready, the medication is ready, the systems are in place, and then we roll out. But the initial phase was really to allow us to do our learnings and to look at the medicines that we have and then be able to say we now can come out and say we are ready to roll out in our facilities. We do want to say there are those patients who will remain on 3-monthly based on their situations, and also those who are on what we call CCMDD, who are on a 3-monthly. But here now we are going to our facilities, which are quite full, and we are saying those who are very well, the top, who don't need to be seen in 3-monthly, they'll then be coming back. Yeah. But importantly, from a system point, we had to test the system and make sure it works before we come out and launch.
I imagine cold storage and all of these kind of issues come into the equation. I mean, you know, stock outs, these are very big things as well. Making sure that distributing large quantities all at once is fine. And also, as you say, you know, obviously when people do come to the clinic to get their medication, they get tests, they have a look, they see, they're hopefully checked upon. But now by making this wider, these visits, how are you going to keep that on top of all of that and make sure that these patients are doing fine?
I think what is important, I would say, is that over 4 million of our patients on ARVs are fine. They are very well, actually, and we've been monitoring them over time. So firstly, you have those patients who over the years have really been consistent, been taking their medication and being well. It's our first point of departure. The second point is that we obviously are aware that at the beginning it's going to be a bit difficult in terms of we are making sure that you have the stock of 6 months. But once we roll it over, Remember, once you have your first 6 month stock, subsequently, it's a matter of knowing that the next batch is coming and when it's coming for each month for the next set of patients that are in a 6 monthly program. So that is what we're looking at. We have assessed in terms of our facilities, the ones who are rolling out at the beginning, they obviously have the space, but also it's only 2 times of 84 tabs that are available in a pack. And clinicians will be discussing with the client in terms of their own keep at home, the package, whether they can be able to store the package at home or not. So I think importantly here is for us to understand this is where we work with our patients and do what we are able to do based on the discussions that we will be having between the clinician and the patient to understand their circumstances. They can keep the medication, but also some people are working who have to take this every third month or month of work, and we are saying they need to be able to be at work, and if they are well and doing well. But all of this is done in the middle. It's a patient-centered approach. You want to make sure the patient is the one who's ready.
Doctor, finally, as I let you go, the rollout date, when are you hoping that this will, I know it's the testing phases and everything, but when are you hoping that this will be happening countrywide?
Countrywide, we are starting, we've actually started in August in terms of what we termed our pilot. So now this launch means we are rolling out countrywide. But I want to stress out, as I said earlier, if the facility is not ready, then they are going to be prepared to be ready. But most of our facilities now are ready and all the provinces are ready. So that is where we will start. We will start initially in the next 3 months with over 200,000 patients. Then we will roll out broader. But it all depends. It's the patient who's with the clinician, it's the facility, and if everybody are on site. But at this point, that is why the minister is rolling out today. It's because we are saying now we are ready as a country to be able to roll out this program.
All right, Doctor, thank you for your time. Thanks for talking to us about this. Dr. Nonhlanhla Ndlovu is the DDG for HIV/AIDS, TB, Maternal and Child Health at the National Health Department, speaking to us about this rollout of the 6-month multi-month dispensing program for ARVs, meaning that instead of having to go and get your ARVs more often, that's now been reduced to just twice a year. So you'll have all of your stocks and you only have to go twice a year, easing the healthcare system and making it, of course, more convenient for those that are taking these antiretrovirals.